Hi, everyone. Thanks for joining us today. We have a really interesting topic to talk about today. It all aligns with Vivid Health, which is provided by Vivid Commerce. It's something that Vivid Commerce has really dabbled into the last year or so for so many different reasons. We really feel that this is a market that isn't touched enough, isn't talked about enough. Market that really can help a lot of ISOs out there, a lot of agents, and to get them into the health space and to kind of learn about how we got into the health space and to really just kind of explore all the different options that are out there because there are quite a few. Um, it's not typically an easy industry to necessarily get into, but that's only because a lot of ISOs don't have the right tools. They don't have the right software to offer dentist office or even a veterinarian office or a medical spa. Vivid over the last year has worked endlessly to find great solutions that will really help out any partner group, any partnership. And really, the goal that we're trying to solve here is how can we get medical offices paid faster? It's the number one issue. Any medical office has just how to speed up accounts receivable. How can we make sure that either before visits, after the office, after visits, how can we make sure that our doctors, nurses, pediatricians are getting paid? So we're going to explore that a little bit today. Vivid Health does have one option that I truly feel is something that really makes it easy. We can offer just basically a whole spectrum of paying, either whether it's through text messaging, paying by phone, paying in the office, and really just connecting payments as a bridge from their into their current EMR system. And that's really something that we want to focus on and something that we want to dive deeper in today. I really hope this is something that is useful for you. If you are not a partner of Vivid, reach out to myself, Vinny, at hellovivid.com. Check out our website, hellovivid.com. That has the whole array of wonderful products that we offer. But today, with Gilbert here from Rectangle Health, he's going to basically guide us in the right direction and just kind of show you how easy it is or how easy it can be for a health office to accept payments, speed up accounts receivable, and really you'll be, if you're selling this product, you'll be the winner at the end of the day for a lot of these health offices. It's just something that a lot of administrators at health offices just don't have the time to research and to get into because there's probably a lot of garbage out there. But this program alone just really solves a lot of issues. So I think we hit a home run here, and I hope this is something that you're interested in. Thanks.
Okay, so we're just going to go through. I'm going to go through like a really, really high level of what some of the bells and whistles are. We won't cover obviously everything. Whenever we do our demos, it's probably about 35 to 45 minutes, depending on questions and stuff. So I'll just give you the Goodyear blimp view. So this is the software. This is Practice Management Bridge. This will be what the office will be signing into every day to get to start the link between that and their EMR system. So like, Derek, you had mentioned Dentrix before, so we can use that as our example in this specific situation. What I'll do is I'll just do a quick transaction to show you guys how the bridge works and getting payments posted into the actual EMR system on an automated basis. And then I'll go through a couple of the other features that Danielle had mentioned, specifically around storing the card on file, doing text message payments, having the ability to have an online portal, those sort of things, because we have all of those capabilities as well. So this is PMB, right? So this is what they would sign into every day. The other thing that I want to show you is just from a demonstration purpose only is eMedDent, which you're going to see this a lot whenever you guys join in on demos from our HBCs. This is not a part of the software. This is not a part of something that the office is going to get. This is strictly just to show how the payment posting occurs. So this is just demonstration purposes only. So what I always say is, just imagine that this is Dentrix. we're going to put on our imagination hats and just say this is Dentrix, and so we'll tell that office manager to show them how the interface works. When you see eMedDent, just think that that's Dentrix, or think that that is AvaMark if it's a vet clinic, or think if it's an eClinicalWorks, if it's an ambulatory clinic, that sort of thing. So they're not going to be getting this. Okay, that's the big gist of that. So one big thing to always remember is for every office manager and every doctor, it's very, very important that they don't have to change very much. They don't have to change how they're doing things. So again, to Daniel's point earlier, we can scale and have the ability to do a lot of things. And the most important is we don't want them to change their EMR system. Whatever they have, we wanted them to keep. Because we want to make sure that they are understanding we're not trying to come in and reinvent the wheel. We're just trying to air up the tire so it goes better. That's all that we're trying to do. And that's what we're going to be able to attain and do with Practice Management Bridge alongside whatever EMR system they have. So again, let's say it's Dentrix. We're at the dentist office. We need to go ahead and pay for our fluoride that we just got after we got our cleaning, whatever it may be. So the office manager pulls up our profile in Dentrix. So the patient profile in Dentrix. I hand over my card and we start the process. So notice I've got, in this case, Dentrix pulled up. You don't even see Practice Management Bridge. It's signed in and minimized in the background. I'm going to enter in I'll insert my card into the Lane 7000, which is the device that we would be provisioning for the office. It's going to beep at me. And once it beeps at me, it's going to pop up a screen to say, go ahead and let's finalize the transaction. So pretty simple stuff. You won't have to, unless it's a multi-location that they want to have multiple locations in one PMB instance, they won't have this little drop-down menu. It'll just be this defaulted merchant account name up top, so they won't have to make that extra button click. So really the only thing they need to enter in is the dollar amount. And a couple things to think about real quickly is this full credit card number here is tokenized and encrypted from moment that it's inserted or tapped on the Lane 7000. So you'll notice all these zeros in the middle. So that is making sure that from moment one that the card number is not attained or seen by anyone in the office, but we can store it on file from the screen. So important thing to remember when it comes to security aspects. Patient account number, patient name, notes. These are all the things that we can type in. So we'll just create a couple of these standard really quick. There's my name, notes. We'll call it FL for fluoride. That's what we're paying. And then down at the bottom, we can either turn this on or have it enabled to where every card is stored once it's swiped or entered into the device for the office, or we can turn that feature off to where they have to go in and actually click on vault this card. So in this case, I'm going to click on it and I can create my vault ID to store the card on file and get them to sign that pre-authorized healthcare form that gives us the ability to store it, and we have their written and verbal commitment that we have their authorization to be able to store the card on file. I've already got mine stored on file, so I won't do all of that. I'll show you how it looks here in a second, but this is where it would pop up. And again, we can make sure that every time a card is swiped, this message will pop up and they'll have the ability to store that card on file if the office would like that capability. Some offices like it, some offices don't want to go through that and they just want to do it on a case by case. Whatever they want, we'll take care of it from there. Okay, so essentially now the front desk person is ready to go. We've entered in the information. I click on submit. It's going to process the card. And then transaction approved. I'm not going to touch anything, but look in the background. What it's doing right now is it's writing all that information over into Dentrix, right? So 2605, here's all the information that we have for that transaction. It's now going into Dentrix. Customer signs on the screen of the Lane 7000, clicks OK, and it's going to pop up the opportunity to then send over the receipt. From here, I can simply email or print the receipt out and then click close, and I'm off and running to the next transaction. Okay, that's the most basic face-to-face instance that you would have in this case. The big thing here is, and the easy part of this is, we're taking all the reconciliation and the manual data entry out of the equation, because now we're writing that transaction, posting that transaction straight into Dentrix from the time that it's entered into the terminal. Okay, so any questions on how that works and the bridge between Dentrix and practice management bridge, no pun intended, on that piece? Any questions on that? Okay.
So great. I think we're good.
Okay, good. So a couple other things really fast. So we mentioned card on file. So let's say we want to charge a card, or somebody, a patient calls in, hey, I got a statement. Can I go ahead and pay my bill? Multiple different ways to do that. One of them is, let's just go ahead and charge the card on file. So patient calls in and we need to charge the card. Great. Well, the first thing that the office is going to do, once they know who the patient is, where do you think they're going to go to find out how much the patient owes? Somebody throw an option out. Where would I go to find out what a patient owes?
Dentrix.
Yeah, Dentrix, right? So I answer the phone, I go to Dentrix, I pull up the patient ledger. They say, yep, I've got a statement for 2503 or whatever the dollar amount is, and they want to make that payment. So I go to Dentrix to verify that. Everything's good. I come back to practice management bridge. They say, go ahead and charge the card on file. Perfect. I can absolutely do that. I click on the run payment, which is a little bank symbol. Again, this won't be dropped down unless they have multiple accounts. And we'll do 2503. And from here, then it's going to do the exact same thing that we just saw. It's going to write that over into Dentrix automatically to make sure that payment is then accounted for and then also reconciled immediately, instead of having that front desk person having to do that manually at the end of the day, which all of them really love to do. No, they don't. They don't love to do that. So that's how we do that card on file. Okay. Now, recurring payments, specifically for dentists. You've got maybe larger dollar amounts that they need to recoup. So the same thing, I can either set up a recurring payment, or I can pull up a patient name and look at a recurring payment, or set up a new one for them. But what's the one thing I need to have to be able to do a recurring payment plan? What do you guys think?
Their credit card information.
Yeah, their credit card. Yeah, I got to be able to grab it. So again, from here, maybe they hadn't stored the card on file before. So I can click on add. And from here, I create my plan. So let's say they owe $500 and they're going to pay it off over the next 6 months. The system does the math for me, which is great because I'm horrible at math. I'm going to start the transaction, start that recurring billing the first of the next month, and it's going to be billed monthly once a month. I click on submit. And then from here, I just type in their credit card number, all of their information, click on submit, and that starts the recurring payment plan to where every month it's going to bill that card for that specific dollar amount for that card holder at that point. Okay, and that can be all adjusted based on whatever the needs are for the patient. Okay, so another good option for an office that specifically has the larger dollar amounts, and maybe they want to do 6 months same as cash financing. Well, this is basically that, but they're just allowing the patient to make that payment each month without actually having to take out a loan or anything like that. So nice feature that we have at our disposal. And then the last thing, and again, sorry to be breezing through this so quickly, but the last thing I want to show everyone is the ability to send a text message and to do collection over that way. So remember, way back at the very beginning of the call, Danielle mentioned how we have all of these new laws going into place to where all of these patients, if they don't have, if the bill is less than $500, if they don't pay that bill, it's not going to go onto their credit report as a negative inquiry on their report. So as you can imagine, all of these doctors' offices, once they're finding this out and we're advising them what's going to happen, they're probably in the back of their mind thinking, well, great, they're already not paying. Now they're definitely not going to pay because there's no negative ramification for the patient at this point if they don't pay, if it's less than $500. So we need to give them more capabilities to recoup payment before it even goes to a collections process, of which the patient isn't going to have any negative circumstance or negative consequences from. Well, one of those ways is sending a text message to them to get paid. Because we all know we don't pick up the phone to call somebody, but we absolutely pick up the phone to text somebody and read the text when it comes in. So let's give that office manager and that doctor the ability to say, hey, let's streamline the process. Let's make it easier. We know that they're going to open this text message. Let's send them a text message. So all I got to do is type in the patient name. Now, again, provided I have to have their phone number to be able to do this. But once I find them and they're in my system, I can simply just click on send a message. Right up in here, it is a customizable note that I can send. So this link is our balance collect link. So what will happen is it'll send the text message over to the patient, and they'll get a little window that pops up to enter their card information in, which I'll show you guys in just a second. But I can type in here anything I want. Please pay now or whatever, right? And we can do that all throughout. Now, and then we also have the ability now, I won't go into it, but we have the ability now to send bulk texting. So if the office has 50, 60, 100, 200 patients that they want to send bulk text out to do the exact same function to try to collect on that, we can do that now as well by pulling all the information from Dentrix or whatever EMR system that they have. So real quickly, here's what it looks like. I have a little video that just shows you what the text message looks like. So here on the iPhone, we send out the text message to the patient. They get a notification, pops up. Again, 95% of the time they're opening the text as soon as it comes through. They click on the link. It takes them to the secure virtual terminal that's going to be branded with that office's information. And then the customer just simply walks through the process of, here's my account number. Maybe it's on the statement, or if they have it, they don't have to enter it. If they don't have it, they take a picture of their credit card number or credit card, and it uploads that information into the virtual terminal, and they just finalize the transaction. Once that's done, they enter in all their pertinent information, and they'll type in their email. They'll click on submit with the grayed out dollar amounts. The office drives how much the patient will have to pay. That will be grayed out. Now we do have the ability to make that edit, have that piece being editable. Or not editable, editable for the patient. They could change that number, but in this case, it's grayed out, and we can go through and then have that allocated to their ledger at that point. So here's the receipt and how it works. And then the office will then get a notification that they received a text message payment. They go in, find it, allocate it over into Dentrix, and they do that for every text message or online payment through a payment portal that they do.
Thank you, Dallas, for your time today. You really have showed us quite an amazing product. And for any of you ISOs or agents out there looking to get into the medical world or the health world in payments, please reach out to me, Vinny at hellovivid.com. My name is Vinny Marzelli. Thanks for your time today. There is so much more to offer through Vivid Commerce that we can show you, and through a partnership with us. So if you have any questions, again, please check us out at hellovivid.com or reach out to me, and we can get you on the right path to moving into the health space and helping these medical offices truly get the service that they need. Thank you, guys. Have a great day.